okay if I lower your gown?
Oh yeah.
Okay, and I'll have you swing your legs over the edge of the bed here and face me. Perfect. Okay. I'm going to assess your abs, your chest. I'm going to palpate it for any crepitus, masses, thrills, and everything feels normal. All right, and then I'm going to percuss her chest. Okay, I'm going to go under here. On this side, and up here. All right, everything sounds good. Going to check for your diaphragmatic excursion. Make sure that your lungs are both expanding equally. Could I have you take a deep breath in? Good. One more time. Perfect. All right. I am going to listen for your lung sound. So I have you breathe in deeply. Good. 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 Don't want you to hyperventilate, so just take it on your time. There you go. Good. One more time. Good. Perfect. Once on this side. Good. Sounds. Good. And two more times. Once here and one time up here. You have good breath sounds. I don't hear any gurgling or anything in your lungs, so it sounds like your lungs are clear. All right, and I'm going to have you turn around for me, and I'm going to assess the back side of your chest. Move your hair out of the way. I'm going to palpate for, again, any masses or crepitus, and I don't feel anything. Everything feels all right. Do you feel any pain or tenderness?
No, that's very nice.
Okay, perfect. And I'm going to do diaphragmatic excursion on the back as well. Can I have you breathe in? Good, even on both sides. All right. Actually, I'm going to palpate first before I auscultate. Gonna auscultate. I'm gonna have you do the breathing in again. Good. Again. Good. Oh, that was a good strong one. Again. Good. Good. 3 more times. Good. All right. The last thing I'm going to do is check your diaphragmatic, I believe it's called diaphragmatic excursion, right? Okay. Yes. All right, I'm going to have you breathe in, and I'm going to hold it for me. I'm going to percuss. Right there. The lowest point. Okay, you can let your breath out now. Sorry about that. And then I'm going to have you just breathe a little normal right now. And then when you're ready, breathe out and hold it. Okay, definitely down here. Okay, go ahead and release your breath. Go right there. And I'm going to do it on this side too, so breathe normally. And then breathe in as hard as you can and hold it. and then breathe out and hold it. So right here. Okay, breathe normal again. Go ahead and measure those. Okay, good, perfect. All right, and I'm gonna have you turn around again. All right, you can go ahead and put your gown back on. And the next thing I'm going to do is assess your cardiovascular system. And lay down, relax, and bring your gown down. All right, you comfortable? All right, going to palpate first for your second right intercostal space for your aortic. Good. And then I'm going to move straight across to the left second intercostal space for the pulmonic. And then third intercostal space. Good. Also known as Ebb's point. And then I'm going to lift your bra for a second, and I'm going to do your fourth intercostal space. So the tricuspid. Good. And then the last one is the fifth intercostal space, and that would be your mitral. Good. And then the precordium of your heart. I'm going to palpate it here in the left sternal border. And while I'm doing this, I'm also assessing your chest for symmetry, color. Everything looks good. I don't see any scars, masses. I didn't feel anything while I was palpating. I'm going to go ahead and listen to your heart. And this is a cardiac stethoscope. So when I put it down lightly on one point, it's going to be using the diaphragm. I'm going to be listening to your heartbeat. Then I'm going to put some pressure on it, and then it's going to switch to the bell of the stethoscope, which will allow me to hear the thrills in that area, or if there are any thrills or bruits or anything like that. Okay, so I'm going to start again at the second intercostal space at the aortic. So I'm listening with the diaphragm. Good strong heartbeat. Press in a little bit. Ooh, very nice. No bruits. Move over to the second left intercostal space. That's the word I was looking for. Listen to the heartbeat. Press in a little bit for the bruits. See if there are any. Don't hear any. Good. And the third intercostal left space. Good heartbeat. Press in here. Use the bell. Nothing abnormal there. I'm going to lift it up a little bit. I'm going to listen to your fourth intercostal space. Good heart sounds, and then push in to listen for any bruits. Everything sounds good there. And the fifth intercostal space is the mitral. Listening to the heartbeat, which is very strong here. Push in and listen for bruits. Everything sounds good.
What I do is just walk in and note his rate, depth, and rhythm of breathing. Just noting that he doesn't look to be in respiratory distress. I'm not seeing any signs of retraction or accessory muscle use. No signs of cyanosis in his lips, and everything looks to be normal at this point. I'll come in and I'll start by palpation. Just noting any firmness that I feel, any tenderness,
no.
Any masses. I'm noting that there's no deformities. The lateral diameter seems to be bigger than the anterior posterior diameter, which is a normal finding. I'm going to start here. Can you say 99 for me?
99. 99.
Good. And that's tactile firmness, and that's used just to see if there's any consolidation. I might feel a little difference. Okay, Again, no masses, no tenderness, no firmness when he's breathing. You can see 99.
99. 99.
Good.
99.
And what I'm feeling there is that the vibrations are equal on both sides, which is a normal finding. I'm going to do thoracic expansion. Go ahead and take a deep breath. Good. Right here, my hands were midline, and I saw as he breathed in, my hands, my thumbs went out symmetrically, which is a good finding. And next, going to do percussion, avoiding bony prominences and listening for sounds of resonance. Good. So next, I'm going to do the diaphragmatic excursion. I'm going to have you take a deep breath in. Hold. All right, good. Go breathe normal. So I had him breathe in, and I percussed down until the sounds of dullness reach resonance. So breathe, and then exhale all your air out, and hold. All right, good. So what I did there is I percussed up until the resonance met dullness again. I would have had a mark here, the first one, and what I would see is that there was about a 3 to 5 centimeter movement there, which would be a normal finding. And I would do the same thing on the other side and expect it to be about the same bilaterally. Next, I'm going to move back to the front side, percussing again over the areas, noting normal resonance, avoiding the heart where it would be more of a dull sound, ribs where that would again be a dull sound. All right, good. So that was a lot of areas of resonance, which is a normal finding. Next, I'm going to move on to auscultation. We're listening for clear lung sounds. I'm going to start here, breathe. Good. Those nice bronchial sounds. Okay. Deep breath. Good. Deep breath. Good. Good. Nice vesicular sounds. Good. And on the sides. Good. Good. So the lung sounds were nice and clear. I didn't notice any crackles, no wheezing. Then I'm going to move on to the back. Deep breath. Good. 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 So next thing I'm going to do is assess for bronchophony, which is where I'm going to have him say 99 again. And let's see what I find. I'm going to say 99.
99.
Again.
99. 99.
Good.
99.
All right. Good.
99. 99.
Good. And what I noticed there is that the sound was pretty muffled and inaudible, not something I could distinctly hear, and that's a normal finding. So if I could, if the E's became A sounds, then that would be equiphony. And then if I, if I felt that was a positive sign, I could have him whisper and see if I hear that as well, which would be pectoral loquy, which would not be, might be an indication of some kind of pathology where there's consolidation or something that was causing the sound to be transmitted. Next, I'm going to move on to the cardiac system. I'm just going to face front. Again, looking, noticing for any signs of like pulsatory mass, any scarring maybe from a surgery. Okay, looking at the jugular venous distension. I'm not noticing any. I'm going to have you lie back. Again, noticing any kind of carotid pulse. No jugular venous distension is noted. It'd be like in this area. Good. Check the carotid. One at a time. Good. Just listen for any bruise with the bell. Good. Good. So that sounds good. No bruise were noted. Just gonna palpate. Again, no crepitus. It's good. I'm gonna go down here to the 5th intercostal space, mid-clavicular line on the left side. This is the point where I should be able to feel a nice pulse matched up with the carotid. Very good. All right. There's not really any areas to percuss. I could try to figure out the size of the heart if it's enlarged by percussing, but that's not really used anymore. I would probably do an x-ray to get an accurate reading. I can also tell by that the heart is in the 5th, in that point of maximal impulse, that would be a normal finding. So next I'm going to move on to auscultation again. using my diaphragm first, listening to all the areas of the heart, or for heart sounds, looking for even rate and rhythm. Okay, that was the aorta on the right side, second intercostal space, right sternal border, and the pulmonic. Left side, second intercostal space, left sternal border, and down to the third intercostal space for Erb's point, between the fourth and fifth for the tricuspid, and down here to the fifth intercostal space, midclavicular line on the left side for the mitral area. Good. So I would go back through and listen to all that again using my bell, just to see if I heard any extra heart sounds, any murmurs. What I am going to have you do is I'm going to be turning to the left side. Okay. And we're listening at that apex again with my bell for any signs of mitral stenosis. Yeah, it sounds.
Chest, thoracic area, and start above the clavicle, making sure to avoid bony areas, going along with the patient's breath. All right, I'm gonna add mid-axillary. All right, lungs sounded clear. I did not hear any crackling. And by the way, I just want to inspect your chest. I forgot to note that there are not any lesions, and you have nothing visually appealing. So now I'm gonna come to the posterior side. And I'm going to once again auscultate. Make sure to avoid bony areas. Bend forward real quick. Now I'm going to end mid-axillary. And once again, no crackling, lungs sound clear. I'm going to check different regions of the heart. So I'm gonna go to the second intercostal right here. This is the aortic region, right of the sternal border. Okay. Same on this side, 2 down, intercostal space, left of the sternal border. This is a pulmonic region. This is the aortic region. All right, and then 3rd down. This is Erb's point where you can hear murmurs. Right, and then 4th intercostal down is, these are all left of the sternal border. And this is the tricuspid region. And then 5th is midclavicular, and this is considered the mitral region. Okay. Alright, so I heard S1 and S2 noises. No murmurs noted. And now that we're done with that part,
I'm just going to inspect your chest. Make sure there's no lesions or anything. Just going to feel around. Is there any pain or tenderness? And just going to inspect your back. So I'm going to test your symmetric expansion. So just take a big deep breath in for me. Okay, awesome. So it's equal. That's all. So now I'm going to listen to your heart sounds. And every time I move my stethoscope, just take a big deep breath in and out, okay?
And have you had any wheezing, any coughing of sputum or
Okay, go
blood,
ahead.
any shortness of breath? Great, thank you. Okay, your breathing seems to be in good working order. Now I'm just going to go and check your heart or listen to your heart sound. So now I'm checking the pulmonary valve.
One more time.
And now, this is the pulmonic, this is the aortic. Both seem to be working well. I can hear both S1 and S2, both sounds.
I'm going to test your lateral airways. One more time, please.
Okay. Can you shift your just stay in just the microphone and just
Okay.
Okay, great. Sounds great. Have you had any chest pain? Any heart palpation? Have you felt dizziness? Any range of motion? Knees?
I didn't hear any abnormal breath sounds at all, so that's awesome. Have you been having any problems with wheezing? Have you been coughing lately? Any shortness of breath? Have you been coughing up any mucus or blood in the past couple weeks? No. Good, awesome. So now I'm going to move on to your cardiac and listen to your heart sounds. And for this one, you can just breathe normally, okay? So I'm going to start with your aortic heart sound. This is your pulmonic heart sound. Great. And then I'm going to listen to your tricuspid heart sound.
Have you been passing on the bowel?
And then your mitral heart sound.
And have you been voiding normally? And any
Awesome. You have S1, S2. They're very audible, no heart murmurs at all. And have you been having any chest pain? Any heart palpitations? Dizziness? Any swelling in your extremities or anything? No. Awesome. That's great.
Feel around in your chest. Just let me know if anything hurts, okay? Everything fine?
Yes.
Okay. All right, and now we're going to do tactile affirmative. So I'm going to place the palm of my hand on your chest. Can you just say 99 for me?
99, 99, 99, 99,
I'm going to go down here.
99, 99,
Okay.
99, 99.
Okay, so resonance was good. And now I'm going to percuss. And I'm going to go down here. Good. And the other side. Okay, good. And now I'm going to listen. All right, so when you feel my stethoscope on your chest, you take a deep breath through your mouth, okay? If you get lightheaded, we can stop. Okay, I'm gonna go down here. feeling okay?
Yes.
And last one. Okay. So now I'm just going to feel for symmetric expansion, okay? So I'm just going to pinch a little bit of skin right here. Can you take a deep breath through your mouth? And good. All right, so now we can do the back, so you can go ahead and turn around. All right. So just tell me if anything hurts, if there's any tenderness. All right. And again, we're going to do symmetric expansion. I'm just going to pinch a piece of your back. Just take a deep breath in through your mouth. And good. All right. And tactile freminess. So when I place the palm of my hand on your back, say 99 for me. 99. Good. 99. 99. 99. 99. 99. Good. 99. 99. Okay, good. And now we're going to percuss. I'm just going to move your sports bra a little bit. Okay, and then same on the other side. Okay. Good, and then down here. Good, and now I'm just gonna listen. So same on the front, when you feel my stethoscope, just take a deep breath in through your mouth. Feeling okay?
Yes.
Okay, good. All right, so you can actually turn back around and lay down. All right, so now I'm just gonna look at the veins in your neck. So can you turn your head that way towards the curtain? Good, and then the other way. Good. All right, so now I'm just gonna look for your apical pulse. And the contour of your stomach. Good. Now I'm going to feel. And now I'm going to listen. Okay, good. So now I'm just going to listen over a few places on your chest, so just sit tight and relax. I'm just going to move your hair.
I'm going to pinch a little bit off the skin in the back, and I'm going to ask you to take a deep breath in, okay? Go Go ahead, take a deep breath. Okay. Very good. I'm gonna go ahead and listen to your lungs. Every time I move my stethoscope, you take a deep breath in, okay? And if at any point you feel lightheaded, please let me know. All right, sounds good. Is it okay if I move your bra as I move along? Okay. Now raise up your left arm for me, please. And your right arm. All right. All right. How are you feeling?
I'm good.
Is it okay if I continue? I'm gonna go ahead and listen to the phone, okay? All right. Okay, very good. Now I'm gonna go ahead and listen to your heart, okay?
Do the respiratory, cardiac, and abdominal assessment. Just putting some Purell on my hands first. Could I have you face that direction for me for this first part of the assessment? Just going to take a look at your breathing, which is even and unlabored, no work of breathing. Next thing I'm going to do is just do some respiratory assessment on your back here. I'll start off with some percussion. Okay, I'm going to percuss the sides as well. So right side, I'm going to do 3. And then the left side, I'm going to do 2. Okay, good. Next I'm going to have you say a phrase as I move my hands down your back. So I'd like you to say 99.
99,
Okay, again,
99,
again,
99,
and one more time.
99.
Okay, good. Now I'm going to listen. Okay, deep breaths through your mouth. Okay, again. Okay. All right, and listen on the sides. Okay, and one more on this side. Okay. Good. Okay, good. All right, could you just turn around to the front towards me? All right, I'm going to start off again with some percussion on your chest. Okay, now I'm going to listen. I'm going to start off by listening up high here. Deep breaths through your mouth. Okay. Good. All right, good. Okay. All right, next assessment we're going to do is the cardiac assessment. I'm just going to have you go in this chair for that. All right, and then we're going to put your feet up. All right, so first, just with inspection, I'm going to look at your precordium. I don't see any lifts or heaves with that. The next thing I'm going to do is listen to some different areas, starting with your carotids and your neck. Okay. And throughout this assessment, I just want you to try to breathe normal, okay? And I'm going to go under here and listen. All right. I'm going to listen with the other side of my stethoscope in a couple places. All right. Okay. All right. Now I'm going to palpate some areas. Start with your carotids. Good. All right, very good. Okay, can I have you flip over to your left side? All right, first I'm just going to feel for your pulse over here, your heartbeat. All right, and then I'm going to listen using the bell. Okay. Okay, good. All right. The last part of this assessment, I'm going to have you sit up, and we're going to put your feet down. Okay. Switch back to my diaphragm on my stethoscope. I'm going to have you lean forward, take a deep breath, and hold it just for a couple seconds. Okay, very good. All right. Then the last assessment.
All right, well, I'm going to start with assessing your lungs, and then I'll listen to your heart, and then we'll see if we can come up with a diagnosis, okay?
Okay.
All right, so I want you to just breathe normal. And as the patient's breathing normally, I am watching for the chest expansion, and I am seeing that the thoracic cage is normal with a normal slope of the ribs. I can see that the patient has no barrel chesting, that she has no lesions, no use of accessory muscles. The patient does have some moles on her skin. So if need be, I would explain these using the ABCD way to assess these. I see that the patient's AP transverse ratio is 1 to 2, and now I'm going to lay my hands on her and assess her. All right, if I can have you fold your arms across your chest like you're giving yourself a big bear hug. You're gonna feel me touch you. Okay, before I would actually assess this patient, I would have washed my hands. All right, now I want you to say 1, 1.
1, 1.
Again.
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 1, 1.
Okay, and what I'm doing here is I am checking for fremitus in the patient. Next, I'm going to percuss. As I percuss, I would percuss in between the intercostal spaces. And when I do this, I am hearing resonance. All right, I'm gonna check for CVA tenderness. You let me know if this hurts, okay?
Okay. Yes. Ow.
Okay, so that's tender back here.
Yes.
Okay. Next, I'm going to auscultate the patient's lungs, and when I auscultate, I will listen in at least 6 sites on the back and 3 sites down. And I'm going to listen with the diaphragm. Big deep breath. Good. And again. Good. And again. Good. And again. Again. And again. And I'm listening to the patient in a side-to-side manner. And I'm listening down her sides of her lungs. And as I listen, I don't hear any crackles, any rhonchi, any wheezing. I hear normal vesicular breath sounds, okay? And I do note that there is some CVA tenderness in this patient. So now I'm gonna walk around to the front and I'm going to just observe the patient. I'm looking again for lesions, rashes. I'm watching her chest expansion. I do not see any use of accessory muscles, no work of breathing on this patient. I do note moles across the front of the patient's chest as well. So now I'm just going to palpate, and as I palpate, I am checking for tenderness, lesions. Any tenderness here?
No.
Okay. And I'm also feeling the patient's skin is warm. She actually feels very hot to the touch, and there's no lesions or masses and no tenderness as well. Next, I'm going to listen in at least 4 lung fields on the front. Deep breath for me. Good. And again. Good. And again. Good. And again. And as I listen to the patient's lungs, she has good vesicular breath sounds with no work of breathing, no wheezing, no rhonchis, and no labored breathing as well. So now I'm going to have you go ahead and lay on this pillow for me. And as the patient lays down, the first thing that I do is I just inspect the patient. So I'm watching the precordium to make sure that there are no pulsations or heaves. At this point, if my patient was not already undressed, I would pull up the shirt so that I could make sure I could visualize her abdomen. Then I will palpate right over the patient's PMI, and I should feel a single impulse. It is at the 5th intercostal space, mid-clavicular line. Next, I will auscultate the apical pulse for a full minute. So as I listen to the patient's PMI, also known as the apical pulse, I can hear that the S1 is louder than the S2. And I get a heart rate of 76 beats a minute as I listen. Next, I will listen to all the different points of her heart. There's 5. The first one that I'm going to listen to is the aortic. So it is the 2nd intercostal space. Right of the sternal border. And I'll listen in the diaphragm. Next, I will move to the pulmonic. And it is 2nd intercostal space, left sternal border. Then I'm going to move down to the Erb's point, 3rd intercostal space, left sternal border. Next, I will listen to the tricuspid. It's the 4th intercostal space, left sternal border. And finally the mitral, which is the 5th intercostal space, left sternal border. And I do that with the diaphragm. And also then I'll go back and listen to the bell. With the bell, I'm specifically listening for the lower pitch sounds. And I'm listening for murmurs, gallops, and rubs. So I start with the aortic. Move to the pulmonic, then to the Erb's point, then the tricuspid, and then the mitral. Good.
Move on down to her chest. I'm going to start with the heart. So to do this, I'll listen in 5 spots, and I'll go over those in a second. But for starters, do you have like chest pain? No. Do you ever feel like someone sitting on your chest? No. Do you ever feel shortness of breath?
Oh.
No. Do you ever like get up and urinate frequently throughout the night?
No.
No? Okay. So now I'll go ahead in with the heart, and I'll start with the A, which is her aortic, which is her 2nd intercostal space, right sternal border. I'll go to P, which is pulmonic, which is her 2nd intercostal space, left sternal border. I'll do her Erb's point, which is her 3rd intercostal space, left sternal border. Then I'll do her tricuspid, which is her 5th intercostal space, left sternal border, and then her mitral, which is her 5th intercostal space, mid-clavicular line. And the way I find this is I'll start at the top of her sternum, go down where I find like a little notch, and then kind of go to the right, and I'll fall into like a little space, and that'll be my first spot. And I'll listen to this with the bell of my stethoscope. Lift your shirt up. Okay, so while listening to her heart sounds, I am noting that S1 and S2 were heard throughout with no gallops, no murmurs or anything of that nature, so that's a normal finding. Like I said, I didn't hear any extra sounds or anything of that nature, so that is a normal finding also. So to move on to her lungs, I'm going to, on the anterior side, I won't do like a palpation necessarily due to the video and her being a female. If I was in a clinical setting, I would just kind of palpate around and everything. So I'll go ahead and start by inspecting. So right now, I'm noticing that her skin is true for ethnicity. I'm gonna go ahead and feel her temp. My hands are a little chilly, but they warm up. Her temp is warm and dry. While I'm right here, I'm gonna go ahead and test her skin turgor. Okay, so there was no tenting, so that means she's well hydrated. I don't see she's not using any accessory muscles. It's a nice, easy breath in and out. So that's all normal. So now I'm just gonna go ahead and her cuts on the front half, starting kind of up here and just kind of going down. So while percussing, I'm noting that it was a nice resonant sound throughout, which is normal for the lungs. I didn't feel any like bumps or anything on my finger while pressing and tapping, so that's a normal finding. So now I'll go ahead and auscultate on the front half of the diaphragm with my stethoscope, kind of in those same spots. So for this, I will just have you take a nice big deep breath in and out, okay? Every time you feel my stethoscope. Okay, whenever you're ready. Just gonna kind of go down here a little bit and then. Okay, so while auscultating her anterior side, I'm noticing that I didn't hear any adventitious sounds, so meaning like no wheezing, no rhonchi, no rattling, anything like that. So that is indeed a normal finding. So now we'll go ahead and just go to her posterior side. Perfect, okay. So to start with this, so once again, I'll just start with inspection. So upon inspection, I'm noticing that her skin color is true for ethnicity. I do see a tattoo on her left shoulder. I'll inspect down here a little bit. Okay, so I see another tattoo just on her lower back. I don't see any bruising, no rashes, no bumps, anything of that nature. So now to start on the back, I will start with palpation. So I'm going to palpate for crepitus. Okay, so I did not feel any crepitus, which would be like a nice Rice Krispie underneath the skin. So that's a normal finding. So now I'll do what's called tactile fremitus. I'll use the ball of my hand. So all I need you to do for this is just say 99 every time you feel my hands, okay? 99, 99, 99, 99, 99. Perfect. Okay. So while doing that, as I placed my hands up top and went down, the sound did diminish, which is to be expected. So that, like I said, is a normal finding. So now we'll do what's called symmetrical expansion, but first I'll map out my lung fields on the back, starting at, can I have you put your head down? Perfect. Starting at the top, which is C7, going down to like the bottom of her scapula, which would be like T7, going down 3 more, which would be T10. These are my lung fields right here. This is where I will be percussing and auscultating later in the video. So when I do symmetrical expansion, this is where I do, I go down to T7, go down 3 more to T10, and I'll pinch right here. So what I'll have you do is take a nice big deep breath in and out. Perfect. So while doing that, my hands rise and fall at the same time. So that is a normal finding. So now I will also do what's called AP diameter. So I will measure her side to her back, starting over here. Okay, so her AP diameter is a 2-to-1 ratio, meaning that the one side is equivalent to her entire back. So that is a normal finding as well. So now I will go ahead and percuss on the back side, starting, like I said, at C7, going down to T7, T10, doing that in the entire field. Lift your shirt up so you know. Okay, so while I was percussing, on the posterior side as well as a nice resonant sound, which is to be expected in the lungs. So now I'll go ahead and auscultate in those same spots with the diaphragm of my stethoscope. Same thing for this side. Whenever you feel my stethoscope, just take a nice big deep breath in and out, okay? Okay, so while auscultating on the posterior side, I'm noting that there was no adventition sounds once again, so there was no like wheezing, rattling, any rhonchi, anything of that nature. So that is also a